What are the biggest secrets that Big Pharma is hiding?
Wow, what a question.
They have a cure for cancer, but they don't want people to get it. They make so much money off people being sick.
At these retreats, people are documenting and reversing cancer. This is not normal. When you talk to Gen Z, every other person has an autoimmune disease. The Ozempic, Mounjaro, semaglutide, which are the biggest business. I've seen retainers as high as $250,000. It can take 4 years for you to detox from eating just one serving of French fries.
I'm in trouble.
Food.
So Money Talks, today I'm with Awais. I want to hear a little description of what you do because you have a very unique job.
Awesome. So it's great to be here. So I have a health practice called Integrative Oasis, and I work on the gut microbiome. I'm trained in a lot of functional medicine. I'm trained in Ayurveda, and I'm very passionate about regenerative medicine and peptides. I have a long history with peptides. I've worked with a doctor that was working with NBA athletes 13 years ago. So I've been very exposed to regenerative medicine. So I integrate a lot of these things to help people optimize their body. And what people know me for is really the gut microbiome. But I really do a lot of things from the functional medicine perspective. Another important disclaimer there is I am not a licensed physician. So I'm in a unique role because I'm not a licensed doctor, but I'm also not necessarily like a health coach per se, because I work in clinical context and I work with licensed medical professionals, so that everything's compliant above ground. So yeah.
Yeah, that I think your job is super interesting. This stuff is becoming more and more mainstream. More and more people are talking about it. People having kind of crazy experiences with sort of mainstream medicine and realizing there's other options. It's also very controversial. So let's just get right into it. Like, what are some big health facts that society is wrong about?
Wow. Well, there's sort of mainstream society, and then there's even our health conscious society, which often misses a lot of things. But let's start with like general. I think some of these health organizations, like the American Heart Association, you know, these organizations around diabetics, right, and some of these other big government funded groups, a lot of the things that they recommend, the research actually doesn't back it. Like one, for example, is seed oils. Seed oils are right now it's something that's trending a lot in sort of these discussions. You're nodding your head because I'm sure
I
people
see it on Twitter everywhere. It's the last few years, I think.
yeah. So it's been trending a lot. So seed oils is definitely one thing that is a lot of people get wrong. And here's what, to kind of throw some complexity into that discussion. Seed oils are not all bad. I actually supplement some cold pressed seed oils, and there's many reasons to do that, for the cellular health, right? So I think if we were to zoom out from that, like I would just call it like lipid physiology, fatty acid physiology. People don't understand how fats work with our body. And so it's like seed oils are evil, seed oils are okay, right? And there's all these posts now you see on Instagram that some of them look like they're funded by some of these organizations, nutritionists talking about, oh, seed oils are okay. So there's kind of like this debate, and I think lipid physiology is misunderstood. Number two would be detoxification. It's something that I think mainstream medicine doesn't necessarily acknowledge. They don't think that it's a thing that needs to be done unless you have some severe toxicology. Like I worked with a woman who fell into a landmine while doing a cleanup operation in West Africa. So that's where conventional medicine is like, you need a detox, right? So I actually, while working with her, I saw how they see detoxification, right? And it's very, very limited, and it ignores a lot of the science of detoxification. And I feel like even our holistic LA conscious crowd gets a lot of it wrong around detoxification, a lot of their approaches are around green juices and, you know, some of these other things and some of these products, right? That people are selling, or cleanses that misses the cellular approach to detoxification. There's phases to detoxification in the cells, from organ to organ, right? From the lymphatic system. So there's so much there that I think gets left out of the discussion, what I call like clinical functional detoxification. So I'll just leave those two.
So in terms of stuff like seed oils, what are they actually doing to our bodies? Like, are these things killing us every day that are in normal food everywhere? And just to kind of refresh, like seed oils is like kind of in everything, right? Any fast food, any packaged food, you know, Nutella, like all that, anything like that is seed oils, right?
Exactly. Yeah. Seed oils refers to industrially processed omega-6 oils. It's not even necessarily the fact that they are seed oils, it's the fact that they're industrially processed and then they're bleached and then they use certain extraction processes to remove the bad smell from it. So something I talk about is I was born in Pakistan, to give you a reference point for how this discussion around seed oils is muddled. We use sesame oil from time to time. We use mustard oil for our hair, right? So I remember smelling mustard oil as a kid, and if you would open this bottle of mustard oil or another seed oil and you left it out for 24 hours, the smell would change. You leave it out for 3 days, the smell would dramatically change, right? And it becomes rancid, and you don't want to use it. It has like now I would call it an oxidized smell, but I don't think most people relate to that from the smell perspective. But it just smells a little bit bad, a little bit funky, like metallic-y, right?
Mm-hmm.
Like, and then I remember when I came to the US and I left out a bottle of canola oil and I left the cap off for a few weeks and absolutely nothing changed. So, from the chemical perspective, they've modified it so you can't tell that it's now rancid, and it's actually showing up rancid. So, what does that do to your body? There's Dr. Bruce Lipton, he's done amazing work in this area. The intelligence and identity of the cell is in the cell membrane, right? Fats, oils, they contribute to the development and creation of new cell membranes in our body. So, when you have bad donors like seed oils, they're going to help to create unhealthy cell membranes. So, on that philosophy of science, like epistemological level, in a sense, seed oils can kind of change the essence of who you are. So, they're bad mainly around how rancid they are.
Are there foods, obviously, like everyone knows, you know, fries are bad for you, fast food's bad for you, people eat it anyway. Are there foods that you would say are really bad for us that people don't realize, or they don't realize how bad some things are and like what they're doing to us?
Yeah, I would say one of the things is white potato fried in seed oils, right? French fries.
Okay.
That is a food that, according to science, is pretty terrible. There was a study that came out a few years ago that showed that it can take years for your cells to detox. Like, it can take 4 years for you to detox the sort of bad lipids from your body, right?
From eating fries.
From eating just one serving of French fries, right?
Oh,
I don't like fear mongering
I'm in
around
trouble.
food. We'll start the timer now. 4 years for you. So I don't like fear mongering around food because oftentimes you travel and all you have is French fries. So I try to live in like a balanced way and accept that we're living in a modern world with some modern toxins. But that's just an important thing, that yes, French fries and foods that are fried sometimes twice or 3 times, that's horrible. Now you're concentrating that oxidization.
Why is everyone seemingly getting cancer now?
Wow. So again, like, I'm not a doctor,
Yeah.
and I'm definitely not working in oncology, right? Like the medical science of cancer. But
I'm asking because I think a lot of these things with kind of traditional medicine, right? It's like just accepted in a way where it's like,
Yeah.
oh yeah, everyone gets cancer. Like, and it's like, oh yeah, wait till you feel terrible, come in. Oh yeah, you have cancer, you're gonna die. Like this, that seems just how it is. And like, I'm starting to just realize like, why are people accepting this when like,
Right.
there's first of all things we can do to like to be healthier. Obviously, a lot of disease and whatever is sort of out of your control, but there's things you can control, and there's also like ways to check way earlier that I've been hearing of recently, and I'm just sort of wondering from a not even from a traditional medical perspective, from someone like you who just understands the body in holistic ways, like what are the things we're doing that we don't even realize that are giving us cancer and other diseases?
So I see cancer as two things. I've read a lot of, just on PubMed, a lot of the cancer research is public, so you don't have to pay for it. So a lot of the detox science actually comes from cancer research, which is something that a lot of people don't know. And when you start looking at this science, what you start understanding is that cancer and oncology, there's two things that contribute to it. Now, if you want to zoom out on like what's wrong with health today, right? And just wanted me to create categories, and especially in this discussion around cancer, there's two things: toxin, microbe. Microbe is bacteria. Microbe is our microbiome. Microbe is the flora that live inside you, right? You are bacteria and flora having a human experience, right? We're more parts bacteria and flora and microbe than we are human cells, right? So then there's toxin as well, right? So there's at least 100,000, 150,000 untested chemicals in the environment. We like to wear clothes, we like to wear shoes, we live in buildings, and a lot of these building materials, often they're introducing new chemical compounds, often in our clothes, right? So toxicology, environmental toxicology is evolving. And what we're finding is that a lot of these toxins, our body has a hard time detoxing, and the cells are overloaded. We have a natural detox capacity given to us by nature, but our cells are a little overloaded by just how much we have today. And then this goes into, right, like why aren't these things more regulated? That gets into a different discussion. And the other thing is these toxins, sometimes which are pesticides, they actually can influence our microbiome in a negative way. So they can facilitate a situation in which you have bad guys, like bad microbes, bad bacteria, and they can help kill off our good bacteria, the good things in our gut, right? So these two imbalances are often very relevant in the research on cancer and oncology.
Do you think there's some kind of new age things that can cure cancer? Like, do you think fasting can cure cancer?
I think I'm very careful with
Yeah.
the word cure, obviously, but I would say I use the term oncology treatment and what are approaches in oncology, and functional cancer treatment, right? Like, what are functional holistic practitioners doing? There's an amazing center that does this work in Irvine, and I know some of the people involved in that community that are doing some of this research, doing some of this work. So yeah, fasting is incredible. Some therapies like ozone are incredible. A lot of Europe uses ozone in this context, IV ozone. There's other IV therapies that are used in this context as well, like vitamin C. And then, from my perspective, when some of these doctors will call me to kind of get my help on a case, it's around that detoxification and that microbiome. And we know that those root causes, resolving those, then when we add in some of these other therapies and interventions, we can have a lot more success.
What are the things that you personally do that I would say preventative or just like, kind of to lead a healthy life in your eyes? For example, like maybe it's fasting, maybe it's a certain, sauna or a cold plunge or a weird sort of on the cutting edge? Like, what are the things that you do that you think are the most important?
Yeah, so a lot of these are super foundational and a lot of these are kind of basic in some ways. I would say thankfully some of them are part of our culture in this kind of area and health community that we're a part of. Sauna is really big for me. I have an infrared sauna. I have a far infrared sauna. I'm going to get a full spectrum infrared sauna, which is near, mid, and far infrared, which has even more detoxing and just health healing properties to it. Cold plunging is good. I try to cold plunge whenever I can. I try to intermittently fast on some type of schedule. Now, there's times when I'm gaining weight and gaining muscle. Like right now, my body needs a lot more calories. So I'm intermittent fasting a little bit less. I might just intermittent fast 2, 3 times a week and, eat within a 12-hour window the other 5 times a week. So that's another big thing for me. I am big into peptides. That's a big part of my just health approach. I cycle them, I pulse them because one time I was recording a podcast and someone commented very angrily, "Why do you need peptides all the time? If you're healthy, is that even a good thing to promote?" Well, it's like, no, I cycle them and there's many reasons to do that from a longevity perspective, not like a health treatment perspective.
Which
And
peptides? Because I've been hearing so much about peptides, and it seems like a
yeah.
crazy business and a crazy, just like people are curing things
Mm-hmm.
magically, seemingly
Mm-hmm.
from it. So, like, what peptides have you seen work?
Yeah, so I'm gonna leave out the weight loss peptides, which are the biggest business right now,
Right.
right? The Ozempic, Mounjaro, semaglutide, tirzepatide, right? I'm gonna leave those out because that's the biggest business. That's probably the reason
Right.
why this industry is growing like it is. But that being said, some of the ones that are very classic and very amazing are BPC 157. That's nicknamed the Wolverine peptide.
It's a cooler name.
It's a cooler name.
I
It
was
is.
gonna say they need to
Yeah.
do a better job branding the peptides because they all have these crazy science names.
Exactly. Yeah. It's letters and then numbers. Well, you have the Wolverine peptide inside of you. It's in your gut. It's called body protecting compound 157, and there's other body protecting compounds in your gut as well. So when you take this, it facilitates rapid healing in the gut lining, in the tissues. Some of the Crohn's and colitis data that was coming out 5, 6 years ago around BPC really transformed the perception around it, just how quickly people were healing, right? So I think peptides have really redefined health in so many ways, like how fast your body is actually capable of healing from so many things, right? So there's peptides for different categories. There's immune peptides, which are very controversial from a legal sort of FDA type of perspective, but immune peptides are really powerful for the immune system. Very profound for balancing different sections of the immune system, right? We're hearing a lot about autoimmunity. Everyone knows at least one person with an autoimmune disease, right? And it seems to be growing more. When you talk to Gen Z, it's like every other person has an autoimmune disease. This is not normal. We shouldn't be just like accepting this. So peptides can help balance the immune system. And there's other muscle recovery peptides. There's peptides that help fibrous healing in the body, like thymosin beta 4. So BPC 157 and TB4 are the most popular peptides, and they've been used in bodybuilding for a very long time. Now, probably before they became popular in like integrative medicine, bodybuilders were, importing them from China and Russia.
Why do you think they are not considered like mainstream or are still? Is it a business thing? Is it some like
Yeah, so this gets into a discussion around intellectual property and patents. I've been so fascinated by this very question that you asked. Why are peptides not more popular, right? For me, they are very popular because in my world they're very popular. But when you step outside, why aren't they standard of care in a hospital, right? Why doesn't someone get a prescription of BPC 157 once they have a shoulder injury or a muscle tear, right?
because basically these things you can inject them into like where you have an injury and it promotes like really rapid healing, right? I've heard someone like tore their Achilles or something and it healed like way faster than a normal thing. Like it's actually like magic kind of, right?
Absolutely. It's so profound. So
Crazy.
profound. And it heals on so many levels. Like my own healing journey with peptides was, yeah, now 13, 14 years ago. I was a very young adult and I had these shoulder injuries that just weren't going away, like tendinosis, tendinitis, myofascial pain syndrome, stiff man syndrome, all these weird diagnostic codes doctors were throwing around. It felt pretty terrible to be entering adulthood with that. So I started reaching out to doctors, doing my own research, and then I found a doctor in LA who was working with a lot of high level NBA athletes at the time. I obviously can't name the NBA athletes he was working with because on paper, nobody uses peptides, right? Especially at that time. What he was telling me is that for like my shoulder injuries, that's probably the best thing. And he tried a few different treatments on me before and they just weren't working. So then he said, I'm going to give you the full NBA stack. And he gave me some BPC and this other growth hormone peptide, and he would inject it locally into my shoulders. And I had the most profound healing I've ever had for that injury. And I became back to normal in no time. And that has not been a problem for me since then. So that just planted that seed in me. And this doctor would print out all these resources on peptides and he would tell me like, you've got to get into this world. And this was like 2010, 2011, right? And he's like, this is going to take off at some point and this really will become at some point like the standard for a lot of these things, right? So when you fast forward to now, 14 years later, why has it not? There's a lot of politics around this and who gets to make money, who doesn't get to make money. The FDA has a revolving door policy. A lot of people serve on the FDA. They serve on the FDA and then they will work as consultants for big pharma companies, right? So this revolving door, I think, has always to me felt a little bit uncomfortable. I have seen this as like a money in medicine thing rather than like this is not effective, because that's what they'll say as when people ask this question, like why is this not available for everyone, why is this not approved? And what they'll say is like, oh well, there's just not enough science, right? And there's not enough safety data. Well, you haven't allowed the safety data to be there, and you also have stopped the process of the science, because it can't be as profitable as some patented drugs can, because these exist in your body. So they can't have the same kind of patents.
Interesting.
Yeah.
Yeah, I have all these injuries. I used to teach tennis and for years would just be like hitting like tennis balls 40 hours a week or whatever. And like my arm is messed up and I have all these injuries that I've never been able to fully fix. And I should probably get on the peptide train.
Yeah, peptides or other regenerative medicine could also be good, like local exosome or mesenchymal stem cell injections, or going abroad and doing your own autologous stem cells where they take it out of your body and then inject it into your joint as well can also be crazy. A good therapy. But yeah, we're able to solve these things in people that are 75 years old. So for a young lad like yourself, it shouldn't be that hard.
Yeah, I mean, I think I've really changed my mind on a lot of this stuff for the last few years, because I used to be very trusting of, kind of conventional medicine. And when you hear like, yeah, that doesn't work, doctors, and not that I'm, but I think when you start to take it, to zoom out a bit, like the foods that they suggested when we were kids and whatever, like sugary cereals and stuff and fruit juices and stuff that were like literally like suggested and the norm. And now that not that long ago, 15, 20 years later, obviously eating sugary cereals is not healthy every day and shouldn't be like a breakfast, or like when they have the commercials, like a balanced breakfast and it's like toast and like sugar cereal and milk. It's so when you see that over like your own life, that's not that long, and you're like, oh, now it's obviously that those are really bad for you, and it's all kind of business. And now everyone agrees on that. It's like, well, if we see that, then we know that there's things right now that are not true, that we're all like accepting. So that's where I've sort of changed my mind on this, just to be more open-minded, and I think more and more people will. But yeah, a lot of people look at sort of this whole industry with a lot of skepticism. Why do you think doctors are threatened by holistic medicine?
Holistic medicine is a broad
Or,
category.
yeah,
Functional,
functional.
integrative, right? But I do think it's a good umbrella for sort of everything that's outside, right? Some of the language is also a tool used to create meaning, right? So for example, a term alternative medicine.
Yeah.
It's an interesting term because why are peptides and stem cells the alternative way to treat a muscle tear, whereas injecting cortisone, which does nothing to actually heal, just sort of blocks pain, right, is considered the standard approach. Whereas the thing that actually can solve the underlying problem is considered alternative, right? So these categories I always found very interesting, like alternative medicine. So in this canon of like holistic approaches, integrative and functional approaches, why do they feel threatened? Well, you spend your entire life essentially going to school, going to college, and then you go to med school, and then you're learning a certain approach. And in med school, you're getting 2 to 4 hours of nutrition. The entire medical school education is 2 to 4 hours of nutrition, right? And that's not even good nutrition education. My sister's a doctor. She's an internist in New Jersey, and it's not good nutritional medicine that they're teaching.
Do you and her have disagreements over stuff?
We used to at some
Okay.
point. We
Uh-huh.
used to at some point, but now she's very. I really respect. She does what's called internal medicine.
Okay.
I really respect the approach of like allopathic is the term used for like mainstream medicine. I respect allopathic medicine. She's getting very much into functional and integrative medicine. So there's a beautiful balance of both because when you have like a serious injury, you want someone allopathic, right? They're better with like acute trauma type things. When you want to heal the root cause of something in the body, functional and integrative is better because it takes into account root cause. Allopathic, they don't have a framework for that. For like, hey, I don't feel great. They're like, okay, well, what are we supposed to do about that? Well, can you look at something deeper? Where is that coming from? So they don't do that, right? So I really like a term root cause medicine. So yeah, there's many reasons why doctors feel threatened. Sometimes it's their own education, that counteracts with a different way of thinking. Sometimes my sister's told me this, like there's interests of people at hospitals, right, that are making money. And it's actually, so this, people will paint this picture sometimes that like majority of people that are in medicine are innocent. It's only this small percentage that's making money and that have like bad interests. And my sister's told me, she's like, no, there's some orthopedic surgeons that know that the hip replacement is not good or beneficial. The knee replacement is not right for those patients. The back surgery, the L4, L5 surgery is not actually going to be helpful, but it's so profitable that they just stay in it and they don't know what else to do. So they just like stick to it.
And people don't want to really accept that it's a business sometimes. Like, even though we know it is. I mean, if you break it down. What are the biggest secrets that Big Pharma is hiding?
Wow, what a question. The biggest secrets Big Pharma's hiding. There's processes through which drugs go through trial to become drugs that are approved to be prescribed. And when you start looking into this world, you start seeing just how much money there is in a drug. And these are drugs that are often just managing symptoms. They're inherently not trying to solve the deeper issues. I don't know if that's a secret or not, but that's just one thing that I've seen. Another thing that I've seen is how are certain drugs discovered. One of the things that I found is it's sometimes there's some research on urine. I know we're in Venice, so you're immediately thinking of urine therapy, right? People are drinking their own urine. So it's not something I personally advocate. It's not something I do.
I've seen that on other podcasts. Yeah, I don't know much about it.
They don't call them podcasts, they call them PCasts, apparently. So there's some drug companies actually research urine. So they'll give you a drug compound, you pee this drug compound out, and then they see how that metabolizes and what metabolomic that becomes. And then they'll use that to develop new drugs. So this is called like metabolomics research. So I was really surprised to see just how much of that is done through our own urine.
You hear people say, for example, I've just heard, this. People say like they have a cure for cancer, but they don't want people to get it because they make so much money off people being sick with cancer, with other diseases. How much of that do you believe? Whether it's cancer or another disease or, obesity even, right? Like they have answers for like why all these things exist. They continue to push fraud. That's what you hear, right?
I would hate to get philosophical, but I have to get philosophical because reality, there's more of a multiplicity than a linearity. Linearity means like there's this disease that causes this symptom, that causes this thing, right? That we see lines. And as I started studying integrative medicine, functional medicine, what you start seeing is there's almost a different approach to knowledge itself. Things have multiple causes, right? So when I think of something like cancer, it has so many causes in the body, right? There's some emotional approaches that are more effective for cancer treatment than drugs are. For example, are you familiar with like Joe Dispenza's work?
No.
So Joe Dispenza, he teaches a very unique approach to mindfulness and meditation, and he's very, very well known in like the spirituality and just transformational world. And his retreats are booked out now, sometimes months in advance. Like each retreat is like 2,000 people. And at these retreats, people are documenting and reversing cancer. I had a friend who had brain cancer and pancreatic cancer at a very young age. She didn't go to like a functional, holistic cancer doctor and go to a Joe Dispenza retreat. She just did the Joe Dispenza retreat. And she went to many retreats, right? And she had to meditate twice a day. And like it's work. It's not easy, but she reversed it. And there's so many documented cases like this with that. So that's, that's the limbic system, that's the nervous system, that's your emotions, right? So that's just another powerful therapy that people often leave out. But to this question of like, what causes something like that? So there's often multiple causes. I think the causes can be emotional, it can be chemical, it can be toxin, it can be microbiome. So it's about resolving everything across the board. And is there sometimes an interest to prevent certain therapies from getting out there? Yes, there is. I think peptides are a clear example of that. There's other things that, even to say it, I feel like I'm being very controversial when I'm not, when this is used all across Europe, but like ozone therapy is very, very effective.
It's like the oxygen chamber.
No, you're thinking of hyperbaric oxygen
Oh,
therapy,
okay, different.
which also has some applications in oncology. But ozone is O3, and it's a gas that is used in IV settings. It's called autohemotherapy. They'll take your blood. You get an IV. Some of your blood comes out. It ozonates. It goes back in. And one of the most popular therapies in the US is called 10 pass. That means your blood passes 10 times through this little thing, and that's half your blood volume. So they're ozonating half your blood volume, right? So effective for so many things. Joe Rogan talked about ozone being one of the most helpful things after he got said virus. And that became like, I remember after he said that, I saw all these mainstream news articles saying that like Joe Rogan should be prosecuted for spreading misinformation. Why isn't he honoring conventional medical authorities? And I'm like, folks, he just talking about what worked in his experience, right? I saw dozens of cases like that with viral issues and ozone. Ozone was extremely helpful, sometimes one of the most helpful things, right? So there's even functional medicine doctors that will stay away from saying the word ozone because they're like, oh, there's not enough proof, there's not enough evidence. But in reality, they're just afraid to be associated with something like that.
Okay, is that similar to like, or the same to like an NAD plus treatment?
NAD is less controversial,
Okay.
but it still has controversy. But I would say,
Because I did NAD plus, I had a terrible experience,
yeah,
and all I heard was like, yeah, you feel incredible after and whatever, and like It was like, this was my experience, 3 sessions of like 5 or 6 hours each time. I was really nauseous the whole time, like, and I had to sit there with the thing for 5 or 6 hours. I didn't feel any different after. And then another doctor said, yeah, you shouldn't do that. It can cause cancer or increase cancer after. And I was like, great. So don't feel better. Super expensive, a lot of time, felt terrible during it, and causes cancer. That was kind of my takeaway.
So, Jesse, you're right to be skeptical of both conventional and holistic, right? Because they're both businesses. I would be wrong to not point out how these holistic practices are also operating in a profit based model that sometimes is not actually helpful to people. With the question of NAD is very profitable, right? Those 3 sessions were not cheap. So there's a huge incentive a lot of clinics have from a growth and revenue perspective to sell NAD when it's not clinically relevant for that person. Like, there's some use cases I have when I would recommend someone do an IV of NAD. There's use cases where I recommend oral NMN supplementation to boost NAD. There's use cases where I will recommend NAD intramuscular shots that someone does themselves 3-4 times a week. And there's a lot of work that goes into figuring out if you're a good candidate for that. There's also many people who are poor candidates for NAD IVs if you have certain things called methylation issues, certain gene SNPs called MTHFR, right? If you have some of these things, which you very well could, you're a bad candidate for it, especially if they don't add what's called the methyl donors into the IV to support your system, because NAD can burn through folate, methylfolate, and B12 and B3 sometimes, and some other nutrients. So when you don't balance that, right? So a lot of people aren't doing this in the right way. Ketamine therapy is another place where I can point the finger at, like integrative clinics, where it's so profitable. You buy this relatively inexpensive ketamine vial from wholesale pharmaceutical distributors. You charge $600 for it. You charge $1,500 for a treatment, right? Whatever the range is. And then you sell a package of like 5 or 10. You train your front office staff to sell 10 packs to everybody that comes there, right? And then everybody's going to ask about it because it's so trendy, right? NAD, ketamine, right? And just like whatever, plasmapheresis, whatever else is trending right now. And it's like, that's the big problem I have, is because I want to work with you and your precision genetics, right? Like, who are you as a person? What does your body need right now? What's your unique genetic makeup? What's your unique genomic makeup? What is your microbiome makeup? What's your whole health history? What's gonna work for you? So yeah, you're right in your skepticism.
The ketamine therapy, that's another interesting one. I hear about that all the time.
Yeah.
You know, people obviously use ketamine recreationally, and then now it's you hear about it a lot as treatment, at least in LA. What's it supposed to do?
So ketamine, I am a fan of ketamine IVs. There's a ketamine clinic, it seems like, opening up on every block. It's big business, just like, semaglutide and Ozempic right now. But I also think ketamine done in the right way, with the right practitioner, the right doctor, the right clinic, the right team, can be very effective and very helpful. It's really like one of the only like legal psychedelics in the US, right? Psilocybin is entering, well, it's approved in certain counties in certain ways, right? And then MDMA will soon also be sort of more accessible legally. But right now it's ketamine. And it can be really profound to just dive in during a journey. It can feel just like a really deep nervous system reset and emotional recalibration. Sometimes you can have things come up that you didn't know were there, that you didn't know were emotional, like triggers for you. So I do find that it can be really beneficial. We know that it can help create new neural pathways. It can boost a process called BDNF in the brain, right? Brain-derived neurotropic factor. So I find it to be profoundly healing, done in the right context, also in the right sequence. If you have a lot of gut problems and dysbiosis, ketamine's not going to solve your problem just because, a cool nurse told you it is, right? You have to work systemically and do things in the right sequences as well.
So one of the big things that you hear people are medicated for is depression, in our kind of, I think in young people, like
Mm-hmm.
that's just been going up and up and up. People on antidepressants, and
Mm-hmm.
obviously from your world, there's a whole bunch of other treatments, including ketamine is
Mm-hmm.
one.
Mm-hmm.
Can you cure depression without antidepressants?
There's many documented cases of people reversing their depression after going off of antidepressants and doing functional approaches. And I think it's about doing things systemically. Ketamine can be very helpful for people, but is there a neuroinflammatory component to depression that's caused by our gut microbes? Is there a gut brain axis that we also should be looking at? My answer is yes. A lot of our neurotransmitters are made in the gut microbiome and then they go to the brain. So I think we really have to start looking at the gut health and start reducing the inflammation that's in that environment, start healing that environment, start adding the good microbes, the good bacteria in there, start removing the bad stuff, right? Some of these bad microbes, some of these quote unquote bad bacteria, pathogenic bacteria, can produce certain compounds. For lack of better words, they poop out certain compounds that we'll call endotoxins that can pass the blood brain barrier and stimulate anxiolytic receptors that can cause anxiety, receptors that can cause brain inflammation.
Yeah, on a practical level, like what would you say that translates to when you say heal the gut? All these things that you're saying in a kind of more medical term, like, am I eating more bananas? Am I going outside more? Like, what are the kind of the actual things that someone can do in their life to get closer to healing?
There's things that people can do, and then there's things that I do in a more clinical context. I'll start with some of the things that people can do. It's so basic, it sounds so easy, but then when you actually start doing it, you realize it's not that easy. So number one is eating a whole food diet. I almost predominantly try to eat whole foods. This means if it comes from a package, it comes from a box, it's pre-packed, even if it's from Erewhon, even if you got it from, your holistic marketplace. I try to avoid it. I try to eat whole food based. So when you start doing that, it can become really tricky. You start realizing how many times you're eating packaged and processed foods. So even just cutting down on that can be so good for your gut microbiome, right? And then some of the other things that people will recommend, like eat more fibers, prebiotic fibers, add this thing in your diet, add that thing in your diet. That's dependent from person to person. If you have, let's say, an unhealthy garden in your gut, right? If we can say the gut is like a garden and you have a lot of weeds that are overgrown, I can't necessarily drop in some good soil, right? Some good fiber and just expect magical things to happen. I have to clean up that environment, right? So I think that this is where like it can just be different from person to person, but I think like whole foods is just a really great place to start.
Yeah, it's hard because I find like this stuff is so overwhelming, and there's so much information that's like sort of conflicting and changes. And a few years ago it was kind of the whole vegan thing and don't eat meat and don't, and then now it's like you go on Twitter and everyone's talking about eating steak, which is like a few years ago it was like, if you're gonna eat meat, don't eat red meat. And now it's like, eat as much red meat as possible. It used to be don't eat butter and don't eat fats. Now it's eat butter, eat steak. So it's confusing. Like now I even see people saying like eating whole ice cream is better than eating vegetables. And I'm like, what? Like, I mean, I like ice cream, I'm down, but like, I don't, it's really hard for people to make decisions. So like, what would you say to that?
In Ayurveda, we have different doshas.
What's that?
So Ayurveda is one
Meant
of
to
the
ask that because I saw it on your site and I was like, I don't know what that.
so Ayurveda is one of the oldest holistic medical approaches. It's at least a few thousand years old. It comes from India, it comes from that part of the world, and it's just a whole unique system. And one of the core tenets of Ayurveda is that everybody is made up of different elements, different doshas. And there's really three doshas. One is called Pitta, which is fire. There's Kapha, which is earth and water. And then there's Vata, which is air and ether. And as much science as I've gotten into in my life, I see myself as a very scientific person. I am involved in many science collectives and, support, writing study designs for some colleagues from time to time. But even with all of that, I continuously find myself gravitating to the Ayurvedic doshas and how we all have different doshas. You have a very different dosha from me, I'd hate to admit, but you have more pitta, more fire, right? Um, in you than I do. I'm more air and ether. I'm more vata, right? Someone who can put on fat a little more easily is more kapha. They're more earth and water. So people need different things, and some people do great with paleo. Some people do amazing with this diet called autoimmune paleo, right? I did it and I felt horrible. You know, um, I do well with lectins. I know there's this, some people say lectins are the worst thing ever. I do amazing with like lectins, with legumes, but I also like to eat meat. I also do well with red meat, with fish, with just a very balanced spectrum. So it's just person to person. It's understanding nutritional genomics. It's understanding your unique constitution. There's vegan bodybuilders in our community, and they're genuinely vegan and they look great and they feel great. There's other people I know who collapsed on a vegan diet and they were doing it right. So everybody's body is so different, and it's all about finding the right balance.
This is just trial and error.
It shouldn't be trial and error because there's ways to understand our dosha and our constitution and to do a personalized approach.
I want to talk a bit about mold. That's something that I've been hearing about more and more, seems like, over the last few years. I actually did a mold test. So I did like the blood test for the mold stuff. And I've had traditional doctors tell me that like mold damage is essentially not a real thing. And then I've had people talk about mold as if it's the biggest thing in their life and ruin their life, and like they're moving houses a million times for it. And so yeah, I want to know your take on it. I'll show you my mold test.
I would love to see your you got the my Michael you got the blood panel.
And I'm curious what you
cool.
think. And it looks like I'm off the charts in terms of mold exposure.
Okay, gotcha. This is really interesting. I also love looking at things just live. So this is cool. So let me first talk about just mold in general, and then I'll dive into your case.
Yeah.
This environment feels clean, by the way, just from my assessment.
Okay.
Yeah, I always wondered. I've watched the podcast and I always wondered. I'm like, that wood looks kind of old. I'm like, I wonder if it's actually a fresh, like mold. It feels very fresh here. So I don't know if you got remediation or something.
So for future guests, we have a mold-free podcast studio.
It's great. That's great. Mold is one of the greatest things ever. This could be an episode unto itself, because the question raises, why now? In the Bible, there's a section on like mold growing in a house, and it says like, tear it down if you see this type of dilapidation. So like, okay, it's acknowledged in this ancient text, and then for 2,000 years, it doesn't seem like people are talking about it as like the main health thing. So why now? There's a lot of reasons for that, and also why in certain parts of the world, right? You hear about it in the US a little bit more than anywhere else. And it's because of how we started building after the 80s. Because of energy efficiency, we started building like hermetically sealed environments. There's something called the vapor barrier, how moisture is supposed to flow in and out of buildings. Those building practices really changed in the 80s dramatically. And other building materials that we started using as well. We started using even more porous materials, drywall type of things. I stayed in a 600-year-old building in Mexico that was made of stone, right? One of the freshest environments I stayed in. And I've stayed in places that were built in 2020 in Venice, LA, that felt horrible because they were built very poorly. And also, it's been raining a little bit here and there. You'll see them putting up buildings and it'll rain and these building materials will get drenched, and they'll just build the buildings with them. So people think they're moving into a brand new building, but it's actually been soaked, And yes, they'll dry it a little bit, but there's moisture damaged inside this building. And people will like pay all this money thinking they're moving into a new building. It affects the body on so many levels. It's becoming such a consuming topic. There's this medical group, A4M, and they just had a holistic like weight loss conference. And one of my colleagues was there, and she texted me and she said, it hasn't even been 2 hours into the conference, and mold is emerging as one of the top topics that people are talking about, even in the weight loss context, right? So now we're talking about something that is both a toxin and a microbe. It disrupts so many processes in the bodies. It's so magnanimous when you look at it on the physiology. It's no wonder that it's becoming almost a primary health complaint, especially in like the holistic and integrative medicine side of things.
What are the effects of it? 'Cause it just seems common that people have mold, especially in like, Venice Beach,
Yeah,
near the water, moisture.
it is because it's near the water, but building construction here is terrible. Developers have cut so many corners. I moved myself multiple times until I found a place that actually just tested clean. It's really a travesty for people who like can't afford to do that. Moving is expensive, especially if you have to break your lease because your property owner or your property management doesn't like accept your mold test results for the building, right? So it can do anything and everything in the body. We used to differentiate symptoms as below the neck and above the neck. Some people have a lot of body symptoms without sinus symptoms, and then some people have respiratory symptoms, but not a lot of body symptoms. As we've kind of seen more patient testimony and patient data emerge in this field, it's just a lot more complicated than that. You can have any type of symptom. You can have your skin get wrecked after mold exposure. Most people tend to have gut dysbiosis, right? Their digestion starts feeling really bad. Constipation can be really common, and that can be one of the harder things to treat and just feel so terrible, like you're stuck. Like mold almost has this texture of being sticky and of slowing the system down, like your gut gets stuck, your brain gets stuck, your brain gets foggy. You like get stuck on a thought or a thing and then you just freeze, right? Brain fog. So gut stuff and brain fog tend to be the bigger things people experience. Respiratory symptoms, skin issues, liver issues, weight gain very often, water retention, which can then influence, your thyroid health and all this stuff. So it can influence so many things.
How do you know what the root is of some of these health things? Like, you hear some people say, well, people that report, let's say, like fatigue, and it's like, oh, well, you're tired because, well, first of all, some doctors will prescribe drugs to fix that thing. Then some people will say, well, you're tired because of X. So it could be, low testosterone. Oh, well, here's a drug to fix that. And then you have some that say, well, why do you have low testosterone? It's because of, mold damage, and we need to fix that. And then why do you have that? So where do you stop?
Yeah, so that's a great question. So this is kind of the intake process in what does the functional medicine intake process usually look like? What does the assessment process look like? And there's some tests I personally like to run on everybody. And then there's some tests that are unique based on someone's unique history, right? Like when I worked with that woman that was cleaning up landmines, I ran some toxicology panels that I normally don't run on most people, right? And I saw some things. The lab actually called me because they saw things that they never see, right? So it just depends on person to person. It's the art of clinical medicine is being able to look at someone's history, being able to look at like basic blood work that your doctor ordered that you didn't pay $5,000 for, right? That most people should have access to, and just looking at that and then going, you know what, I can decipher some clues with your history. I can corroborate these data points. And based on what you're telling me, based on where you lived, I want to run a urine mycotoxin panel, or maybe in your case, a blood mycotoxin panel, right? To see what kind of history we've had. I maybe want to run an endocrine panel, look at your hormones, right? I want to see if you have low testosterone. And so it just depends person to person. And there's sometimes reason for skepticism of the holistic world, because there's some people that'll just order a million tests and it's like thousands of dollars, and it's not covered by insurance, you know?
Yeah.
So you're like, people are like, well, what do you know, like, I don't even know if I want to start it, if the start of the process looks like this, right? So it just depends person to person.
So I'm curious your thoughts of
Yes.
that. Like, this is interesting. So I paid, I think, $500 for this test. Doctors would be like, "What is this? This isn't even like real. It doesn't even mean anything." So I'm curious what your take is. And from how I read it, it seems like my mold toxin levels are high on all the different ones. Yeah, it's just interesting to hear from your perspective.
So looking at this, some of them are high, and some of this could be because of acute exposure, and then some of this could be because of historic exposure, meaning that you had this exposure and it's kind of still in your body for some
Mhm.
reason. In Venice, I see a lot of the penicillium toxin exposure. Actually, I see that even more than other classical mold mycotoxins. And I think it often comes from kitchens. I've worked with lab companies that'll test the homes and home environments, and a lot of the Venice kitchens that are tested will have the penicillium toxin, which you have. And then there's some other mycotoxins like T2, the vercarin, and the satrotoxin that are elevated. And then we're seeing the vomitoxin, which is elevated, and the penicillium, again, a little bit elevated, and the IgE antibodies. So the different antibodies can tell us different histories of exposure as well. One can be more acute, one can be a little bit more past exposure. There's definitely more historic exposure, and then there's some, according to this, current exposures. And this doesn't have to mean current as in like right now. It could still mean like you were exposed 3 months ago. Even in this world, I'm not like alarmist. There's fear mongering that happens with mold. In LA, everyone has that friend that you're like, hey, let's go to a thrift store. They're like, no, sorry, too much mold there. I can't go to the thrift store with you. They're like, hey, come meet me at this cool hip coffee shop. They're like, I can't even step foot into there without being triggered, right? Now, sometimes people are that sensitive, and sometimes they've been fear mongered a little bit. The crazy story I like to talk about is this doctor who, I'm not going to name her, but she would recommend the most insane things. She said she was transporting a computer, which I don't see how a computer can be, her laptop, which can become damaged by mold from moldy environment. And then some other technology in her car. She already bought a new car because she felt like her moving her clothes contaminated her car, right? Totally fine. She got a new car. Good for her, right? Then she's moving some technology, and she said that she felt her car was compromised again. So she sold that car and got another car after that, you know? And she actually said the first car, she didn't feel ethical selling it. So she dumped that car. Absolutely ridiculous. That means that if I sat in this chair and I have some mold because these were from a thrift store, then your next guest that comes and sits is contaminated, right? It's ridiculous and it's fear mongering, right? Which I'm very against. It's all about person to person. This is by far not the worst test I've seen. This could be someone who is not symptomatic. This may actually, if I was to look at all your labs, this may not be the thing I would even start with to help improve or optimize your health. There might be different things we look at, but the vomit toxin can, especially if it's, acute and kind of more recent, it can cause some gut dysbiosis. Nothing causes leaky gut quite as much as mycotoxins like this particular toxin in the body.
What's the cure for this? Let's say you have mold exposure. Like, what do you do besides
So,
move and change cars 3 times?
yeah. So number one, you get out of the environment. Number two, you want to start binding the mold. And there's many different ways we can bind it. You can use charcoal, you can use some clay-based binders that can bind certain types of mycotoxins. You can also use some pharmaceutical binders. There's a prescription for something called a Welchol or cholestyramine. I've had doctors I work with use that prescription regularly with their patient, with our client slash patient population. And some of those binders can be really, really effective and just help people feel better instantly because they're pulling some of the toxins that are sort of stuck to the cholesterol. So they help bind and pull the cholesterol out from the bile in the gallbladder and through the liver. So by pulling those toxins out, sometimes people can get like some mental clarity. And that's already a really good sign. There's many debates in integrative medicine around what is the right approach, what is the most effective approach. There's some people, some of my friends that may listen to this and they're going to be rolling their eyes like, oh, always talking about pharmaceuticals. Pharmaceuticals are all bad and evil, right? And I don't have that approach. I find that some of these in the mold context are very helpful, very important. And then sometimes, depending on what types of toxins we're seeing, what type of exposure we're seeing, we'll use certain pharmaceutical antifungal drugs. So like fluconazole, itraconazole under the brand name Sporanox. Now there's another one called voriconazole. I just think of like Dragon Ball Z when everything is like, evolving and getting to the next level. And with these antifungal drugs, it's kind of the same way because as these things in the environment evolve, like mold, the drugs also sometimes have to evolve with it. So, voriconazole is like the new boss that's been released. And now there's new bosses that are coming out after that, right? This is the most relatable discussion you'll ever hear of antifungal drugs. But yeah, so that's another approach that used along with many different ways to detox. And again, this is what's tricky about this stuff is it's just you may have more in your lymphatic tissues and we may need to pull that out from your lymphatic tissues. You may need certain nutrients because you became deficient because your body was fighting this mold growth, right? Some people may not need those same types of micronutrients. So working on mold with people, I've just found that everybody's so unique.
You mentioned leaky gut. What is leaky gut?
Yeah, so leaky gut is, our gut barrier is essentially one cell thick, which is just fascinating. What's separating you from the outside world is literally one cell thick. So what'll happen is there's some mechanisms in the body to open up that gut barrier a little bit, right? And those are there for a reason. They serve physiological functions. But oftentimes when we get damage to our gut lining from environmental toxins, pesticides damage the gut lining, right? Roundup, glyphosate. US consumes more glyphosate than any place in the world. Last statistic I saw was like 25% of the world's glyphosate like we consume, right? That was patented as an antibiotic. So we know it's not good for the gut lining. It'll quite literally attack the gut lining, trigger some enzymes. Those enzymes will tell the gut lining to open up. As soon as this happens, and if this happens for extended periods of time, which it usually does when we're talking about gastric permeability or leaky gut, is some of those proteins the food proteins enter the bloodstream. Food proteins don't belong in the bloodstream. So the immune system is now forming a response and starts attacking those proteins. So it's triggering sort of these autoimmune type of cascades in the body, and then it's triggering certain types of inflammation in the body. So it's a very trendy topic, leaky gut, because a lot of people have it, and then a lot of people will read about it and they're like, this is what I feel like is happening. I feel like something is leaking, and then as soon as I eat food, I get a fuzzy brain. I can't think after my meals. This obsession people have with fasting and just how much better when they feel when they're not eating. Yes, fasting is good. There's many reasons to fast, but a lot of it is adaptive because of leaky gut. I heard someone a few years ago telling me, oh, I follow the executive diet. I was like, what's the executive diet? I've never heard of it. And they said, oh, I don't eat until noon, and then my first carbohydrate is after 4 p.m. So I try to do all my important meetings in the morning because if I have a carbohydrate, it makes me feel a certain way and I can't make decisions the same way. And I'm like, have we become that sensitive to carbohydrates and just food in general? So we have, because we're less resilient now because of that. Many people are having that gastric permeability.
Yeah, I want to get into kind of the business side of it a little bit.
Mm-hmm.
Just switching gears. I mean, your business is basically private clients.
Mm-hmm.
How does this whole industry work?
How does the holistic and integrative like medicine world work? So there's some doctors and practitioners that are finding unique ways to bill insurance. I've worked in contexts where some things are billable, like certain labs are billable. I'm working with a doctor that's, I'm ordering labs through this person, and then we're finding ways to bill for these labs or bill for maybe a few things, right? Oftentimes that's just so tricky dealing with insurance. Wastes so much time, so much resources are invested. It's a bureaucratic nightmare, So I commend all the integrative doctors and practitioners that are able to bill insurance for anything. Majority of this world is not insurance billable, so it's cash pay out of pocket. Some doctors and practitioners do consults where you can just book their time for an hour. You bring your questions to them, or they've ordered a lab and now you're going over it, and then they're giving you a protocol. You book their time every time you need to see them. Naturopathic doctors usually work like that. They're the most prominent in this integrative ecosystem, and they do a lot of good for people. They help a lot of people. It's relatively accessible, right? You just pay for that visit and you get a lot out of it. And then there's the retainer model, which is retaining time for 3 months, 6 months, right? Or sometimes even a year, and just that like longer term commitment. Now, I have found the retainer model to be a little bit more beneficial for my private clients. And this is because I can dedicate the right amount of time, because oftentimes I need to do a lot of back end work. Back end work in this like quote unquote concierge type of system can mean a lot of things. It can mean casework where we're diving into someone's unique health history, their labs. It can mean talking to other people on their team. If they have a nutritionist, if they have other doctors that they're working with, it means talking to those people, right? It may mean even talking to their assistant, or if they have a private chef, right? So then we're talking about people that are a little bit sometimes more elite, right? In that aspect. So it's coordinating a lot of that work and just like digging a little bit deeper into that person. So that's what the retainer model is usually for, so that you can retain the time. And also, structured visits doesn't always work, because let's say in a month we have 2 visits, but you have questions in between those visits. I used to work with integrative doctors and naturopaths during my own healing journey, and it would be nerve-wracking because you have all these things that come up in between visits. And then you work with a doctor that like has a system where you can message on this like encrypted HIPAA compliant system, and it's so confusing to send this message out, and like you're waiting so long to get a response. So the retainer model, what it's supposed to do is give people that level of access and give people a peace of mind as they have things that come up. Or maybe I want to see someone during a unique intervention we're doing. I want to talk to them 3 times in 1 week. So that's why retaining time, almost like an attorney, makes sense. Now, where I think this industry, where it gets criticized sometimes, is that retainer model has given birth to like concierge medical practices and integrative concierge practices, where there's some doctors, and some doctors become like celebrity doctors, and then you retain their time for a year, and they're actually not doing all of that. The retainer just means that you can see them. Oftentimes it means that you're still paying for the visits, but it's the fact that, hey, this concierge doctor has an 18-month wait list, and if you pay them 25,000 or 10,000 or 5,000, you now get to see them. So that's kind of what it's turned into, but they're not doing the back end work for you very often, and they're not oftentimes digging through your whole health history and kind of doing that deep work that it often takes to get someone to optimal health. So that's where this industry sometimes gets a bad rap, is these concierge retainers. I've seen retainers as high as $250,000
For a year.
for a year. Yeah, I just heard of a retainer that's $500,000, right?
Crazy.
Popular ones I've seen are like 100K.
And how many clients would that person have at that time?
So some of those doctors that I know, I was blown away. There was a doctor I know, he built a system that I thought was actually pretty ethical and sustainable, but he also built a business out of it. He was charging like $6,000 to $8,000 for a whole year, with just a certain amount of visits. And then between that, you can see the nurses. But still, like some of his patients were telling me that they don't feel like they're getting his attention, and he's not really diving into the case that much. And I talked to him. I was like, "How many patients do you have?" He said, "Oh, right now I have 1,000." So do the math there, right? It's just like, it's insane. I was like, how could you possibly have the time so each person's getting like just a few short visits a year, right? For that time, right?
So you said 6,000 to 8,000 a month?
No, 6,000 a year.
A year.
Yes,
Okay.
so that was like a lower retainer for very low.
But still, that
visits.
means $6 to $8 million a year
$6 to
he's
$8 million a
taking
year.
in,
Exactly.
which is crazy, which
Yeah.
is a nice size business.
A nice size business, but some of those people, I knew some patients that felt like they were being served because there was a system and in place to serve them, and then some felt like he wasn't digging into their case. Another practitioner I know who has $100,000 a year retainer, he has 25 patients. Again, a very healthy business. And so don't get me wrong, I know some concierge practitioners that do an amazing job, that try to go above and beyond, that are serving holistically. But sadly, I also know many, and I'm often, working on the team with another concierge practitioner on a case. And I know many that are not really present, and they built a cool brand, and now they have a wait list of 100 people, and they actually will work with 50 to 100 people at a time for 150K a year with 2 short visits a month that gets you. And that's considered prize that to even get in those situations. And yeah, I don't like to see that, but I'm not like saying that everybody is doing something bad. I'm also not saying integrative doctors should not be making money and finding ways to make their businesses profitable, right? I'm just talking about the money side of it.
What can you say about your business? Like, how many clients do you have? How much do you charge? Like, how does it all work?
I find that this is my main passion. I consult health tech companies in the space as well. And sometimes I'll consult clinical operations for a big clinic. And I do some other work in the space on the business side of things. But this is what I enjoy more than anything, is that one-on-one work. So it's mostly full-time for me. So I find that I don't like to have more than, in one cycle, more than 15 to 20 people. And that fills my time up pretty significantly because I'm kind of doing the back end, I'm documenting. I'm almost like doing project management for their health in a sense, because people show up so stressed because they've gone to people who didn't help them organize. They're like, I was paying someone, and every time I showed up, it's like I'm a new person, right? It's like we're supposed to be keeping a history and thinking about, hey, Jesse, what's the next step for you? Not like you asking, what's the next step for you? There needs to be bigger plans, right?
That's how I feel about a lot of traditional doctors too. You see them, that's like, in your mind, it's like you're thinking about your health all the time, and you go in and you want them to care a lot. And like the reality is they have like thousands of patients, and to you, you're just another hour in their year. And it's like, oh yeah, okay. What did we do last time? Oh yeah, you came in last year. Like they don't even remember you, you know?
And it's just like my sister as an internist, like I have sympathy for allopathic doctors. I have a lot of sympathy for the patients as well, but I have a lot of sympathy for the doctors. She told me a few weeks ago, she was like, Awais, I saw 35 patients today.
Yeah, that's crazy.
How much time do you think I have to give them? She'll just come home crying sometimes. She's like, this is insane. Like the amount of people she needs to see and like deal with. So with like my personal model, there's definitely a range based on the needs that people have. But it's a few thousand for the 3-month retainer. I've tried to keep it at a place where it allows me to do my job, to allocate the enough time, while being comfortable and not charging above that, right? In many ways, I am a businessman, but I try to make that as accessible as I possibly can. And then there's another side of it. Like, I am intimately involved with a lot of conferences and research collectives that are happening, right? Like, so I have to be able to participate in that. And that is why people appreciate working with me. Like, this month, I've gone to one mold conference already, and I'm going to a second big mold conference in Texas, learning from one of the OGs in the space right now, and what he's updated and what updated testing he's doing, which is so different from what people are thinking, right? So to continuously integrate new technologies and new tools and new systems into this work.
How'd you get your first client? And
So
what would your kind of response be to there's that whole camp of people that would say, well, you're not a doctor or whatever. Why would I listen to you? Why would I pay you that? Why do people pay? You know?
I love that question. And there's definitely people who just won't even enter into my horizon because they've already dismissed, right? That. But then there's a lot of people that come to me that were referred. A lot of my first clients were actually medical professionals or doctors. Literally, my first 5 clients, 3 of them were MDs. One of them was a high level functional MD. So, right off the gate, I was interacting with this ecosystem, and some of them have helped me build my business and my practice and are sort of my medical directors and my referral partners. There's a unique freedom that I have because I work closely with licensed professionals, so I can access a lot of these things like labs in a very legal context, right? I can refer someone out to a colleague who's licensed to prescribe, and ask them, like, do you think it's appropriate to prescribe? And then, so there's an infrastructure there that lets me do these cool things in a very legal way. And then also, I don't have to risk losing my license because I'm talking about things like peptides on this podcast. I feel like I can talk about things with greater liberty, and I have colleagues I work with that are doing amazing things with peptides. That they're like not willing to talk about it, or even they'll exclude it entirely from their practice because of that legal sort of gray area. And then FDA sort of regulated peptides October 2023, right? It was a pretty big ruling. Except semaglutide, and except like one other profitable peptide, all others are regulated. But many times when I'm referred by some of my doctors, I operated like a ghost before I had a brand. I was just kind of getting referred clients from my colleagues, and there was nobody outside of that would know who I am or what I'm doing, right? It was just strictly referral based, underground, right? So now I have a brand, and it's a little bit different with that. But
What was the decision there?
so the decision was, I want to have a bigger impact as I work with health tech companies and as I work with AI health companies with some of the gut work that I'm doing, which is sometimes some of the most complex work. I want to find ways to scale that at a very accessible price point. So, like maybe a 6 month program that's digital, that uses AI tools, that's relatively accessible from a price point perspective, and that's scalable, that thousands, if not hundreds of thousands of people can access, because I'm very concerned with the state of gut health in America. And I'm very concerned with the trajectory that Gen Z and the new generation is dealing with just bad gut health. Some parents I've worked with want me to work with their kids, and I'll talk to their 15-year-old son, and these kids talk like they're 45 years old about their health problems, like got these bad knees, had this thing done, it's otherworldly. It feels like the Twilight Zone. Health is entering this Twilight Zone era, right? So I want to scale things. So that's kind of why I'm now building this brand, so that eventually I have something that I either partner with someone or have a digital system that can just help lots and lots of people on their gut health.
I want to end off with just one really good story from you of somebody who you helped that, let's say, the traditional medicine world failed them and you found kind of a different solution and kind of what that looks like.
There was a client that I worked with out of Ohio who was diagnosed with Crohn's disease, and he was prescribed this class of medications called biologics. The most famous biologic is Humira. It's an immunosuppressant. So for conditions like Crohn's and for many other conditions, doctors will prescribe it. It'll suppress the immune system. So from a whole body approach, functional practitioners usually don't like the idea of suppressing your immune system. This client of mine, he came to me and he was on these biologic treatments. Very symptomatic, having diarrhea, loose stools. He was working with one of the top gastroenterologists and medical teams in his area. So I got to know his entire medical team and their background, and all reputable people. And his gastroenterologist said there's no correlation that nutrition can have any impact. That's where this gets into like the twilight zone, and just like this sounds like the most insane thing. A medical professional saying that there's no correlation from nutrition. So just with the nutritional approach, he lost 10 pounds. His inflammation went significantly down. His symptoms significantly reduced. And then when it came to resolving the complexities of the microbiome, right? I spoke to his gastroenterologist, got all the labs and everything I needed. And I was like, is there any history of fungal growth, parasitic growth? And he said, no, absolutely not. No, we did the cultures for that. There's nothing there. I ran slightly more advanced testing and found 2 parasites and Candida albicans overgrowth, right? A fungi. So that's a lot for the body to be dealing with, especially with a Crohn's diagnosis. We resolved all of that in the body. We did a few phases of things and herbs and botanicals, and under the guidance of another medical professional, an antifungal pharmaceutical, right? So we did all of that to restore the microbiome balance. Then we used a combination of peptides to heal and seal the gut lining, to nourish the whole ecosystem, balance out the immune system, right? One section can be inflamed, another section can be low, right? So you balance the immune system using something called immune modulation. There's many immune modulating therapies, and his inflammatory markers started getting so low, he was no longer in the diagnostic criteria for some of the things he was diagnosed with. And he just skipped a dose of the biologic he was on, this particular biologic medication, which I'm going to choose not to name because, we know how these pharma companies sometimes get. So this is a popular biologic used in Crohn's disease right now. And his doctor called him and said, we need to do the treatment. You need to come in and you need to get this injection, suppress your immune system. And I'm not talking about Humira. This is a newer one, more popular one. And he comes in and he's like, hey doc, I've been looking into this drug. I'm working with this other person now that you've spoken with, and things are getting so much better. I don't feel like I need this treatment. I feel like my inflammation is getting super controlled. And this is not me saying this, is he came to me and told me. He said that this gastroenterologist told him, if you don't get this treatment, I'll have to fire you as a patient. Like, you can't be my patient anymore if you don't get this treatment. And he told me that he felt the darkness in the room, and that there was almost this other agenda there, that his health was almost secondary to this other agenda. There's many great doctors. Spoke about my sister. She's a great doctor. And he told me he felt that this gastroenterologist was not that he had another agenda, and that he was happy to be fired as his patient. And today he's been virtually symptom-free, and he'll use peptides intermittently to keep his gut health in check. And he lives a completely different life. He looks like a new person. I saw him a few months ago. I didn't recognize him through the Zoom call. Like, it took me a minute.
That's crazy.
Bags disappeared under the eyes. So much weight lost. He can eat so many more things now.
Just one of many crazy stories.
Mm-hmm.
Well, that was very interesting, very educational. Thank you very much for coming on the pod. That was
Awesome,
great.
man. It was great to be. This is awesome.
Yeah.